As we see the curve flatten, we can begin thinking about permitting some businesses to resume operations. And we want to reinforce that by increasing the importance of testing and contact tracing. We've talked a lot about testing. We've talked a little bit about tracing. And we thought it would be important today to talk specifically about how contact tracing works, what we've been up to, what our results are so far, and how we see the future with respect to this. And as we think about reopening the Commonwealth, there are many things we still need to do as part of our daily routines, like wearing a face covering in public when you can't maintain social distancing, washing your hands, and appreciating the hygiene issues associated with disinfecting surfaces frequently. And of course, we have and continue to increase our testing capacity, and we actively support someone when they test positive so that they can isolate and recover. But to bring the fight fully to the virus and get ahead of it, we also need to identify confirmed cases and the people they might have been exposed to, their so-called close contacts. And that's where contact tracing comes in. Contact tracing is a common public health tool that's used for diseases like measles, tuberculosis, Ebola, Zika, and now COVID. And it's usually done by local boards of health or by our State Department of Public Health or by nonprofit organizations in collaborations with governments, especially in developing countries. And for such a contagious disease like COVID-19, tracing is a critical part of how we take the battle to the virus. Last month, we set up the Massachusetts Community Tracing Collaborative. This group is a collaboration with local boards of health, the Department of Public Health, and Partners in Health, which is a nonprofit located here in Massachusetts to contain the spread of the disease. We were the first state in the nation to launch a statewide program in contact tracing, and we're fortunate to have the expertise of Partners in Health on board as we launch. The doctors supporting us have worked on fighting diseases like Ebola, and they've proven their model can work in places with far more challenging circumstances than we see here. We believe this tracing program will be a key element toward not only stopping the spread of COVID-19, but also toward understanding where the virus is, who's it's infected, and where, if we need to invest in hotspotting. If you test positive for COVID-19, you'll be contacted by the Community Tracing Collaborative or your local Board of Health. On that call, we want to be sure that you have what you need to isolate yourself while you recover. That might mean food if you haven't been to the store in a while, or other needs. We'll also ask you who you've been in close contact with for the previous couple of days before you started to have symptoms, or a couple of days before your positive test if you didn't have any symptoms. Then we need those people to pick up the phone. We want them to know why they should stay home, and we want to make sure they also have what they need to isolate and quarantine effectively. If you get a call or a text from your local Board of Health or from the MA COVID team, it's vital that you take that call. Doing so means you're helping your family, your friends, and your community, and the rest of us, by reducing the spread of the virus. This call is your chance to fight back against COVID-19. So far, tens of thousands of Massachusetts residents have participated in contact tracing. To date, the Community Tracing Collaborative is connected with nearly 14,000 confirmed cases and reached out to more than 7,500 of their contacts since calls first started on April 12th. The Mass COVID team includes more than 1,600 people making calls. While more staff is anticipated, the team's working at nearly full speed, a remarkable accomplishment in barely a month since we announced this initiative. The median number of contacts reported by each confirmed case remains at about 2. This is a good sign that people are taking social distancing seriously, but that doesn't mean that folks can let up on the social distancing now. You'll soon hear from 2 people who will share their on-the-ground experience with our community tracing program. Damone Chaplin, Public Health Director for the City of New Bedford, and John Welch from Partners in Health. They're already doing tremendous work, but for this effort to be successful and grow quickly, we need residents to answer the phone and to talk to our contact tracers when they call. Please, if you're contacted by the collaborative, please take the call and provide the relevant information to the caller. Phone calls will be from an 833 or an 857 number, and your phone will say the call is from MA COVID team. This is very important. If you see MA COVID team, please pick up the phone. We'll continue to do all we can at the state level to push back against this insidious disease, but this is your chance to be part of the fight against the virus and to help us all get back to a new normal and contain the disease.